what autism is, the symptoms of autism, and how people are treating it now. What is autism? According to autismsociety.org, autism is defined as a complex development disease that typically appears during the first few years of life. It affects a person's ability to communicate and interact with others. Autism is defined by a certain set of behaviors and is a spectrum disorder that affects individuals differently in various degrees. Who is affected? It is estimated that 1 in every 110 children is diagnosed with autism. It is also estimated that 1.5 million individuals in the United States are affected and that tens of millions worldwide are affected. Studies suggest that boys are more likely to get it than girls, and that 1 out of 70 children with autism in the United States are boys. And that's from autismspeaks.org. Some symptoms are, according to autismsociety.org, characteristic behaviors of autism may or not be apparent in infancy, but usually become obvious during early childhood. As part of your child's well visit, your doctor should be checking these development progressions and ask specific questions about your baby's progress. The National Institute of Child Health and Development lists 5 behavioral signs that parents should look out for, and one is that if your child does not babble or coo by 12 months, does not gesture, point, wave, or grasp by 12 months, does not say a single word by 16 months, and does not say a 2-word phrase on his or her own by 12 months, and has any loss of language or social skills at any age. Having these symptoms does not mean your child has autism, but it could be a sign that they should keep an eye on them or get evaluated by a team, such as a neurologist, a psychiatrist, and or a pediatrician, therapist, speech language therapist, or learning consultant, or anyone else in a school district perhaps. Some symptoms in older children, like someone who's diagnosed already, some of their behaviors would be does not startle at loud noises, has a heightened or low sense of sight, hearing, touch, or smell or taste. They might find normal noises painful and hold his or her ears. They may withdraw from physical contact because it's overstimulating or overwhelming. They might rub surfaces, mouth, or lick objects. They seem to have a heightened or low response to pain. And this is from the U.S. National Library of Medicine. Some communication problems they might have are cannot start or maintain a social conversation, communicates with gestures instead of words, like might point instead of saying an actual word. They might develop language slowly or not at all. They might not look at you directly, probably may not make eye contact at all. They don't refer to themselves correctly, like if they're saying a sentence, they might say I want milk instead of you want milk, they really mean I want milk. They might not point to the correct object or not. Repeats words over and over again, almost like a parrot, just like they know a couple of phrases and they'll just keep saying that over and over again, even if it's not right. Some social interaction problems they might have are they're withdrawn, doesn't make friends, or has no interest in others. They might have no interest in talking to anyone, being with anyone. They're fine usually just being by themselves. They probably won't make eye contact or smile. They may treat others as objects, like they don't realize that you're a person and just push you out of the way, like you're a door or something, they could care less. They prefer to spend time alone, then they show lack of empathy. Some real behaviors is they might act up with intense tantrums. They might get stuck on a single topic or task, have a short attention span, has very narrow interest. I know I was a kid I babysat for, and all he just wanted to do was sit there and watch Barney. That's all he wanted to do. Is overactive or very passive, shows aggression to self or others, shows a strong need for sameness, and uses repetitive body movements. While there is no cure for autism, there are treatment and education approaches that may reduce some challenges associated with the condition. Intervention may lessen the disruptive behavior, and education can teach self-help skills that allow for greater independence. Biomedical treatments. There are many established and some new autism treatments and interventions in the domains of medicine, education, and behavior. Biomedicine interventions are those that attempt to focus on the physical needs of a person as a biomedical organism, addressing defects or engaging weaker pathways by medicine or chemical means. Like a lot of kids who are diagnosed with autism are also ADHD, so they're also taking Ritalin and other types of medicine like that to help them calm down and relax. There's also natural treatments, like art and music are particularly useful in sensory interaction, providing visual and auditory stimulants. Musical therapy is good for speech development and language comprehensions. Songs can be used to teach language and increase the ability to put words together. And art therapy can provide a nonverbal, symbolic way for a child to express him or herself. Like a lot of kids, like they'll sing songs not knowing what it means, but they're still using words. And there's also animal therapy, which may include horseback riding or swimming with dolphins. Therapeutic riding programs provide both physical and emotional benefits, improving coordination and motor development while creating a sense of well-being and increased self-confidence. This is from Autism Society. And my review, I explain what autism is, I explain the different types of symptoms in children and adults, and I talk about different types of treatment. Questions? Those are my resources.